Hey everyone and welcome to Get Set Ma. Before we proceed, please do click on that red button at the corner of this video and also below it to subscribe to our channel and click on the bell icon to turn on notifications as well. Now everyone around the world is talking about the current outbreak of the coronavirus COVID-19. It has swept across the world, causing a distressing number of deaths. Many people are suffering from it and quarantined. Some have recovered, and authorities and health professionals around the world are constantly working to contain it. So this episode is going to be all about the coronavirus, and we shall share a few tips with you that could help you secure yourselves and your children from it. So to begin with, let's understand what it is. Now, coronaviruses are a large family of viruses that can cause various illnesses which can range from the common cold to more severe diseases. So you may have heard in the past about the Middle East Respiratory Syndrome or MERS, COV, and even the Severe Acute Respiratory Syndrome or SARS, COV. Both of these were a type of coronavirus, and a novel coronavirus is a new strain that has not been previously identified in humans. Just to speak about coronaviruses in general, they are zoonotic. A zoonotic disease, by definition, is an infectious disease caused by bacteria, viruses, or parasites that spread from non-human animals, usually vertebrates, to humans. The current novel coronavirus is called the Coronavirus Disease 2019 or COVID-19. And what do we know about this novel coronavirus currently? Well, this virus and its impact on humans is still emerging, and there is new research still happening. Researchers are currently working on this, and there is no existing medical antidote or vaccine for this infection in humans as of now. It's pretty contagious and is spreading to different parts of the world at a fast pace. So with a disease or infection which is new to humans spreading fast, with no known medical treatment and increasing fatalities, the best way to protect yourself is to prevent its occurrence. And if you see symptoms arise, then to act swiftly. The CDC, which is a recognized American body for disease control, states these are the symptoms to watch out for: fever, cough, and shortness of breath. According to the WHO, which is the World Health Organization, some people may even get a runny nose, sore throat, aches and pains, and the incubation period of the virus is 2 to 14 days, though some patients don't show any symptoms and don't fall sick, but may still be a carrier of the disease. They further state that most people, about 80%, recover from the disease without needing special treatment, and around 1 out of every 6 people who gets COVID-19 becomes seriously ill and develops difficulty breathing. It is mainly spread through bodily fluids such as mucus and saliva. So if an infected person sneezes or coughs without covering their mouths, then these can be inhaled by a healthy person and they can contract the infection. Also, if an infected person touches these fluids and then touches a surface, then that surface can get contaminated. And a healthy person can get the virus if they touch that surface and further their own mouth, eyes, and nose. Now, how do we try and protect ourselves from this infection? Firstly, don't panic. Secondly, based on the current WHO findings and recommendations, follow relevant precautionary measures. While we adults are aware of the epidemic and understand the importance of taking precautions, children may not understand how important it is. So you may need to make a game around it, or even have a small reward for your child to follow these measures if required. Now, Ilham's Lego friends are going to demonstrate 6 precautions recommended by health professionals around the world that can help. So number 1, wash your hands regularly and thoroughly with soap and water, as that can kill viruses on your hands. And for the same reason, we recommend using an alcohol-based hand sanitizer, especially when outside or after touching unknown surfaces or when traveling. Number 3, avoid crowded places when possible. In case you are outside and see someone sneezing and coughing, do not panic. Try and maintain a 3 feet distance between yourselves and them. Number 4, try and avoid touching your hands to your eyes, your nose and mouth, and wash your hands thoroughly before touching any of these. Number 5. If you or your child are feeling unwell or show flu-like symptoms, then stay home. Do not self-medicate and contact your doctor for medication. Keep track of the latest news on COVID-19 and stay away from traveling to and through places currently considered as hotspots for the disease, especially with children. If traveling is unavoidable, then please follow the necessary precautions. So educate yourself and everyone around you about this disease. Stay safe and stay updated. Please try not to panic. If your child has any of the symptoms and if you feel the symptoms are not subsiding or there is unusual discomfort, then please visit a doctor immediately. Every state has come up with helpline numbers and centers for screening of suspected patients as well. Contact your GP for help in this case also if required. Like everything else, the more information you have about this means you are more informed and aware about it and know how to deal with it. Please do go ahead and share the video, and thank you for watching. Bye bye and take care.